So much of my cosmetic surgery from abroad has gone wrong, but so did the surgery that I had in England. Number 1, do you have the qualifications and, if applicable, the licence required for surgical practice in your country? If so, please show them to me so that I can check them. Number 2, do you and your clinic or hospital have the insurance required for surgical practice? If so, please show it to me so I can check it. Number 3, has your clinic or hospital ever suffered with MRSA or any other hospital infection? Number 4, how regularly is your clinic or hospital inspected and by who? Number 5, who have you got in your surgical team? Number 6, do all the members of your team speak English? Number 7, what emergency backup does your clinic or hospital have? Number 8, does your clinic or hospital have an intensive care unit? Number 9, what aftercare do you provide, and do you stay in place for as long as the patient stays in the clinic or the hospital or the hotel where they're staying? Number 10, what is the risk of deep vein thrombosis on a long-haul flight following surgery, and what, if anything, do you do to minimise the risk? Relating to question number 9, what aftercare do you provide and do you stay in place for as long as the patient remains in the clinic or the hospital? What I understand from the many cosmetic surgery procedures that I've undergone is that if there are going to be any complications with your procedure, those complications will tend to develop within the first 48 hours of the procedure. And therefore I think it is a requirement that your surgeon should be around for at least those first 48 hours. And I would actually go as far as to say the surgeon should be in place at the clinic or hospital for at least a week after your procedure if you're going to be there for that long. And we are the tourists, we're the ones who are only there for a few days and are going to be going back home again soon afterwards. However, the surgeon, even though he or she is based in the country, for all you know, might be planning to go on holiday straight after your procedure, or might have to go and travel for any other reason. So that's why it's important to check that they're going to be sticking around, as I say, for 48 hours to 7 days, in my opinion, after your procedure. Now, you can ask these questions, of course, but the surgeon might lie. So these 10 questions that I've given you by no means guarantee that you're going to have safe cosmetic surgery abroad, but at least you know that you're doing your best to ensure that you do. Now, on the note of communicating with the surgeon, that I think is what you should do. Communicate directly with the surgeon. If you communicate, say, with the surgeon's representative or assistant, say, there might be a miscommunication or a miseducation that you might suffer. In other words, the assistant or representative could tell you one thing about your surgery, and then when you finally travel to the place for your procedure and you speak to the surgeon for the first time, the surgeon might tell you something completely different. I have had that. I speak from experience. So organising your surgery with the surgeon, do your best to ensure that you are communicating directly with the surgeon. Now, most of the questions that I've recommended you to ask are all to do with, as I say, safety, making sure that the clinic or the hospital is a safe, reliable place. But you also need to check, of course, that the surgeon, him or herself, has the skill and the competence to give you your desired outcome from your surgery, assuming your desired outcome is realistic in the first place. So you need to check the surgeon's skill and competence. One way to do that, of course, is to check before and after pictures of the procedure that you're after that the surgeon's performed. And you want to check that the surgeon has lots of experience in performing the procedure on people with features similar to your own, people who had the same surgical requirements to you originally. And you'll want to ask questions like how often, this is linked directly to what I've just explained, how often the surgeon does the procedure, how often it goes wrong, why does it go wrong, what does the surgeon do when it goes wrong. I am Gina, I'm 46, I am from London, England. Do like this video, or rather give it a like. Do subscribe if you haven't done so already. I recommend you, if you're planning to have cosmetic surgery, whether at home or abroad, to get my free guide that shows you how to choose a cosmetic surgeon. It's linked in the description box below. I'm not a cosmetic surgeon. I don't know the first thing about medicine, but with all the cosmetic surgery that I've had, I believe that my advice and experience can benefit people who are looking for cosmetic surgery. Other ways to check the surgeon's credentials: realself.com, social media. We have cosmetic surgery abroad for four main reasons. Number one, cheapness. And I have to say, as long as you've done your due diligence on the surgeon and on the clinic or the hospital, there is no compromise in standards. I have had cosmetic surgery abroad, and I've also had cosmetic surgery in England. So much of my cosmetic surgery from abroad has gone wrong, but so did the surgery that I had in England. Reason number two, privacy and anonymity. Now, in summer 2012, I had a tummy tuck in Belgium, and for the first few days after the tummy tuck, I had to walk hunched forward in order to protect the scar. And I didn't care about going out and walking in that way because I was a stranger, nobody knew me, and I knew I was going to be leaving again quite soon. So I really didn't give a toss, I was anonymous. Number three, in many countries outside of the UK, clinics and hospitals have had no history of either MRSA or any other hospital infection, unlike the UK. Number four, depending on how long you stay, you get adequate rest and recuperation. I always stay days and days and days because I like my rest and recuperation. On the note of accommodation, I recommend you to treat yourself. Stay somewhere luxurious. After a procedure, you'll be in discomfort and pain in some cases, or even if you're not, because a lot of procedures, luckily, aren't painful. You're still going to look a mess, bruising here, swelling there. So at the very least, to cheer yourself up, be somewhere 4-star or 5-star, and just allow yourself luxuries during the first few days of your healing and recovery process. If you've got someone going with you, fantastic, because surgery is lonely. Or if not, if you're able to get to know other people who are there having surgery, that's great as well. Everywhere I've had my surgery, there've always been people from the UK having a surgery, and in a lot of cases, well, not in every case, but in a lot of cases, like in Tunisia in 2007. It was just great, we were all there for the same thing. We all had the same fears and worries and concerns, and we all sort of gathered to each other and comforted and supported each other, and it was a nice experience. My next video, or another video that might interest you, should be flashing up here. I'll meet you there.